Hello, today I will explain about LSCO, L-shaped pedionasal thread from elastic. Let's unbox it. Here is LSCO, and when you take it out, it looks like this. As you can see, there is folded part, and the first marker, second marker, and third marker. Remember this thread folded part outside the first marker. Now, how do we insert this into the nose? Take a look here. It will be positioned like this inside the nose. This folded part near first marker, it's facing downward. So when we insert LSCO, this part should face forehead. When the nose is like this, you first insert the cannula part, and then you pull it out like this, 3 to 4 centimeter, and then you reinsert to the dorsum part. And next it gets fixed like this. This way it is positioned in an L shape. Now, let me explain each marker usage. The first marker indicates how deep to insert vertically at the initial skin insertion point. Then you can change direction and proceed towards the columella. The second marker, as you can see here, shows that this L-folded part, the red part in the diagram, is at this position inside the cannula. And the third marker helps to estimate the position of the L-shaped fold inside the nose when it goes into the skin. As shown in the diagram next, when the second marker disappears, as you enter the columella, if you stop there, it might be slightly visible from the skin. However, if you go deeper and the third marker touches the skin, the L-shaped part will be positioned 2 to 3 mm below the skin. In this way, LSCO is inserted most superficially. There are two methods for LSCO insertion. One is bone touch and one is the second marker insertion. So the bone touch method is the deepest insertion, while second marker insertion is the most superficial insertion. The former lifts and supports the cartilage, while the latter fills the nasal tip volume. Let's say we do a bone touch method. When we pinch the nose upward and stretch it forward, it looks like this. In this state, inserting the L-shaped thread will support the cartilage in an elevated state. So compared to the traditional I-shaped support, the L-shaped support better resists the downward force on the cartilage. It can structurally support to minimize cheese wiring. And for the second marker insertion, the cartilage lifting won't be powerful because there's no direct support to the anterior nasal spine, but L-folded part will fill the nasal tip, and this allows for better nasal tip projection and volume. So let's say, using 4 threads, 2 bone touch and 2 second marker insertion. The blue threads will lift and support the cartilage, and the green thread will fill the nasal tip. And this part will increase the volume of the nasal dorsum. For better result in duration, using a minimal amount of filler along with the threads will complete the procedure. For example, injecting 0.1 to 0.2 cc of filler above the deep bone area will increase support without altering the shape. More filler can be used to make more change in columellar philtrum angle. Also, 0.1 to 0.2 cc of filler can be used to add more volume or contour the nasal dorsum and nasion area, and 0.05 to 0.1 cc can be used to project the nasal tip more. If the patient already has an ideal nasolabial angle, lifting the nose would expose the nostrils from front view. The traditional I-shaped thread was less effective because it cannot fill the nasal tip area. However, LSCO can be used to add volume to the nasal tip. Insert the first two threads deeper than the green threads, but not deep enough to bone touch. And the following insertion like green thread, second marker insertion, the most superficial one. This will allow the 4 threads to fill the nasal tip, and also in this case 0.1 to 0.2 cc of filler can be used for better results and duration. And similarly, use filler on the nasal dorsum and nasal tip as previously explained. Now, let's watch the procedure video. The most anterior part is nasal tip, and create an entry point 2 to 3 mm below the nasal tip. So create paths towards both dorsum and cannula. So remember that LSCO is L-folded thread, so it has directionality. So folded part outside near the first marker should be facing toward forehead to place LSCO in right direction. First, insert the first marker gently until it disappears. Then pinch up the nose and pull it forward as much as possible. If you go down directly to the base, it could damage the cartilage, splitting the cartilage. So first move the cannula forward and gradually raise the angle to 90 degrees while advancing until you touch the bone. And push and secure the end with your left middle finger while pulling out. Remove 3 to 4 cm and reinsert perpendicular to the entry point. It's important to make sure the skin at entry point does not invert it to avoid dimple. The supratip area has thick soft tissue, so inserting superficially to shallow sub-Q plane here. And from the half point, pinch up hard and angle the cannula up and go deep layer. Once you touch the cartilage and periosteal plane, smoothly follow the plane to deep fatty layer. After insertion, stretch the nose forward and upward and push and secure the end and pull out gently. Now, I will show you the second marker insertion where the third marker touches the skin. It's the most superficial insertion of LSCO. So when the third marker touches the skin, the L-shaped fold will be placed 2 to 3 mm below the nasal tip, filling nasal tip area. So be careful not to damage the cartilage structure. So move forward a little bit and gradually angle up the cannula. And take the sponge up, then you will see the second marker disappear and the third marker touch the skin. Then push and secure the end and pull out. When you're inserting multiple threads to the nose, threads get stacked in the same space. So spinning cannula slightly while advancing is very important to avoid interaction between cannula and existing thread cogs. Otherwise, cogs can get stuck to the cannula and moved upward. After you finish insertion, stretch the nasal tip forward and upward and push and secure the end and gently pulling out while spinning. This is the elastic filler from Dongbong Medical, the same company that makes LSCO. After thread insertion to the nose, 0.2 cc of filler to the anterior nodular spine area can support and enhance the longevity of the results. You see how cheese wiring effect can be minimized by changing the shape of the thread I to the L shape and also the support with the HA filler to the base. And also you can inject around 0.2 cc of filler to contour dorsum line and nasion volume. We can reduce the amount of filler with combination of threads. Total usage is less than 0.5 cc and it's relatively minimum amount of filler and it does not make dorsum wider over time. Thank you for watching.